Hello, thank you for being here and welcome to Conversations with the Expert. And I am so excited that I have Dr. Adam Harrison with us here today. He is a phenomenal expert, and I can't wait for you to meet him. Welcome, Dr. Adam Harrison, and I'd love for you to just introduce yourself and tell us a little bit about yourself.
Thank you. Thanks so much, Dr. Rashmi. I wouldn't know about phenomenal, but yeah, I'm I'm some kind of phenomenon. But I won't go any further.
He's not yet knighted, but soon to be.
No chance. So I am primarily by training more latterly. I'm now a life leadership and executive coach. But originally my trade was a physician. I was a family physician. So I went to medical school a long time ago in the mid-90s, worked through my kind of internship, was very set on becoming a forensic pathologist. But that didn't happen for whatever reason. I did general histopathology for a few years and just didn't enjoy it really. So I went down a surgical route, wanted to be a surgeon because I enjoyed that side of things. And I worked with a succession of quite challenging bosses. And I felt like I was on the receiving end of bullying on many of the jobs that I worked on. So I thought, well, if I went to work as a family physician, I'd have more autonomy. I wouldn't have people kind of like to be answerable to for the next so many years. So I went down the family medicine training route, and yeah, I didn't feel fulfilled in that line of work either. And I think kind of harking back to the forensic pathology thing, I had this interest in the interface between medicine and law. And I think I just had to scratch that itch, basically. So I went to law school and trained to be an attorney and qualified. And then we had our first child, and it was just not a good time to be taking a massive pay cut and going into the law as a junior. When you get used to a certain income in medicine, to kind of drop it, as you know, is really quite hard sometimes. So I used the law qualifications to get into medical leadership. So I worked as medical director and vice chair of an organization and stuff. And it was while I was in those leadership roles that I had some leadership coaching. And for me, it was, and I know it sounds really cheesy, and a lot of people say this, it was transformational. It was like a light had been switched on for me. And I just thought, this is so good. It's so impactful. It's what I want to be doing. I didn't feel like I was making much of an impact in clinical practice. And I thought, well, if I coach people, coach doctors, work with leadership clinicians, having worked in leadership myself and seeing that, was pretty toxic in areas, I thought, well, maybe I can make a difference and actually have much more of an impact than I could do as a doctor. So I trained to be a coach. As you know, I spent the last couple of years in Australia and New Zealand because of my wife's work. So I did my coach training in Australia. And yeah, I've been getting it up and running now for the last 10 months or so. I've developed expertise in coaching around bullying, around toxic leadership, and working with the organizations and working with the victims or targets, whatever you want to call them. Just from my own experience, I felt that's what really resonated with me. So yeah, that's where I am. I'm sort of leadership and I'm coach of people who've been bullied, and do a bit of careers coaching as well for medics and other professionals. So yeah, sorry, a bit long-winded.
That's a brilliant story, and what a fascinating array of rich experiences, both life and, professionally for you. We like to talk about well-being and that sort of thing. So what overarching themes would you say you've seen in all of these different areas? I mean, literally all over the world. What overarching themes do you think you've noticed as far as like whether it's in the physician culture or just professional culture in general?
Yeah. So Yeah, I guess having worked with doctors and a few lawyers as well, in the UK, Australia, New Zealand, and I've had quite a few physician clients in the States as well. Um, I think the main common themes are really the opposite of what you and I would like to achieve in professionals. So if you look at all the wellbeing strategies, which I think we're going to come back to, um, doctors and other professionals suffer so much from lack of sleep deprivation, lack of exercise, eating badly, poor diet, disconnect with their family and friends because of their shift patterns. They're not practicing mindfulness. That all of these sort of basic fundamental well-being strategies that are just go out of the window, I think, with the kind of work pattern and intensity and number of hours that professionals have to work. And then I think I see a lot of the other themes in professionals that are probably related to well-being and health, but not directly, like overwhelm, stress, burnout, obviously, moral injury. So you're working in an environment that isn't in accord with your values, your own intrinsic values, kind of starting to lack empathy, and that's all sort of tied in with burnout as well. Not being able to regulate your own emotions very well, and this goes back to the bosses that I've worked with who just seem to not be able to keep calm and not just fly off the handle. And then other things that I think have a big impact on health and well-being that I see in professionals are, the problems from bullying, just poor time management, because we're kind of torn here, there, and everywhere, and we're exhausted a lot of the time because of the shift patterns. Perfectionism, imposter syndrome, comparitis, as you call it in the States. I think we call it comparisonitis in the UK. Not feeling like you can be assertive. So when people are aggressive to you, you just take it. And there's a lot of kind of like junior doctors, residents, and interns that will just accept that kind of behavior, and not being able to manage conflict well. So just seeing it as like aggression, but really, or as a negative thing, when really conflict can be very productive and can create innovation and so on if it's done well. So these are all the kind of the things that I see really regularly. But of course, all of these or any of these can contribute to anxiety, depression, substance misuse, and even sadly suicide. And there can't be that many doctors who haven't been touched by knowing someone who has taken their life because of the horrors of the job.
Right. Yeah. No, really everything that you talked about fully resonates with me. There is a certain toxicity that tends to run through different programs, I've noticed for sure, and a kind of a machismo and aggression that is somewhat actually reinforced in some of the some of the settings that I've worked as a physician. And I think just being able to even talk about it is a really big deal. And then to have someone like you who is trained to help people, sort of work through that muck and that mire, that is really something. I mean, your services are incredibly valuable. So I wonder if you tell us maybe a few strategies to effect some changes.
Yeah, definitely. So, I mean, anyone who's heard me and Dr. Darren Davidson in our Clubhouse Club, high performing physician rooms talk will know that I kind of, the way I structure kind of how to improve wellness and well-being is by talking about creating a bedrock. First of all, a bedrock of health and wellness, of basic skills on which you can build a foundation of more advanced skills. And then obviously on that foundation, you can build the house, the building, or whatever, which is your life. That's your happy, fulfilled personal work and family life. that can be constructed on that. But you have to start with this, the bedrock. So I recommend going with really basic techniques to improve your health and well-being, first of all. And these three are kind of what spring to mind, first of all. So the first one's a bit of a cheat. The first one is multiple, actually. It's the 5 ways to well-being. So practicing the 5 ways to well-being. I don't know if that's a concept that you guys use or
yeah, it's a
and,
holistic, whole health, mind, body, emotional, spiritual wellness. Absolutely. Yeah.
It probably came from the States, actually, and we just copied it, to be fair, but
it probably came from the East, from the actual ancient wisdoms of Ayurveda. We're all copying it.
Actually, no, I agree with that totally. So that's basically things like connecting, not necessarily in person, but also online, being active, giving, not just of money, but of your time. So doing voluntary work and things like that, taking notice, so being mindful, and just continuing to learn. And then so that's 5 things within my first thing. But then there's also the really basic things like sleeping well, eating well, having meaning and purpose in your life. One that's really important to me is connecting with and living by your core values. And then the final one would be limiting your social media time, because personally, although it's for me, it's a necessary evil, social media, but it's I think ultimately can be quite detrimental to well-being. The second of the 3 is just simple breathing exercises. So you can do box breathing if people know how to do that. That's just taking a deep breath for 4 seconds, holding it for 4 seconds, breathing out for 4 seconds, and holding it again for 4 seconds, or other deep breathing exercises. And you will know about lots of them through your meditation and yoga work. And of course, these, are good for just generally calming you down. It's good to just deep breathe occasionally anyway during the day. I think it opens up those airways that we normally practice quite shallow breathing, don't we? And I'll notice with my Apple Watch, I'll kind of check my sats from time to time, like 86%, seriously, how am I not on the floor?
Diaphragm.
So it's like, okay. And then you notice it though, you take a few really good deep breaths and it shoots up to 99. And that just shows that we're not opening up those airways a lot of the time when we're breathing. But it's obviously really good for, when you're in a stressful situation, an anxiety provoking situation, a panic situation, to, those deep breaths, all kind of part of activating the parasympathetic nervous system and calming you down, lowering your respiratory rate, lowering your heart rate, lowering your blood pressure, just making you feel calm. And I talk about, people who are in the situations of being bullied in the moment, where they're being shouted at by someone, just to try and if they can, concentrate on their breath, and it will calm them down. And and people who are, or equally the bully really, for the perpetrator, if they're finding the anger is rising within them and the red mist is appearing or whatever, for them just to do some deep breathing exercises and calm them down. So it's good for anger, it's good for people who are upset, good for people who are very stressed. And the American Marines are big proponents of box breathing and so on. So I think, if they do it, then it's a good thing to do.
Oh yeah, absolutely.
And then the final thing in the bedrock for me is meditation. So, obviously, we know that's very good for calming and, working towards inner peace and so on. But it's also really effective when it comes to mental acuity, how to better handle conflict. It's been proven to be beneficial in that. I know that, again, going back to the American military, use a combination, I think, of mindfulness, loving kindness, meditation, and yoga to help them with post-traumatic stress, with things that have risen out of, being on the battlefield, homesickness, actually chronic pain, helping with chronic pain and so on. So, meditation is absolutely, fantastic. But then moving beyond the kind of bedrock, so we talked about that, and then onto the foundation before you get to the kind of happy and well life, hopefully. There's more advanced skills. And so a lot of these for me are kind of positive psychology based ones. So things like journaling, writing down and reciting positive affirmations, reflecting on gratitude, having a gratitude practice. And I heard a really good phrase for that a couple of months ago, which was having a tank full of thankful.
Like that,
It's really good. That was a vicar at my daughter's school, the chaplain at my daughter's school, who kind of did a service, a tank full of thankful, or a gratitude attitude.
Yes,
You know, they're all good. Also things that went well that day, you know, so writing down and reflecting on 3 things that went well at the end of the day. Because, you know, again, we're certain professionals, certainly physicians, you know, we're perfectionists, and we'll concentrate on that one thing that went badly that day, and take it home with us. Or, you know, we see 30 patients and one of them was an absolute stinker, and all you do is you forget about the 29 other patients that were either, you know, kind of middle of the road, or dare I say even pleasant, and you'll just come away obsessing about that patient that was really toxic.
Yeah.
So then at the end of the day, if you can think about 3 things that went well, it will, you know, override that. So things like visualization techniques. So visualizing yourself as being happy and successful, practicing self-compassion and self-forgiveness. You know, I always think it starts with yourself. And, you know, if you can't forgive yourself, how can you learn to forgive others? You know, if you can't be compassionate towards yourself. And just silly things like smiling and laughing more, you know, and hugging. All of these things are good for, you know, releasing endorphins, serotonin, dopamine, oxytocin, all the kind of like feel good neurochemicals and hormones. So someone said to me, a neuro coach friend of mine said that sometimes when if she's feeling a little blue, she'll look on her phone at old photos and just kind of relive the happy memories from those old photos, and it gives her a bit of a boost. That's quite a nice, easy, quick thing you can do, because most of us are kind of surgically attached to our phones, aren't we, most of the time? So
that's true. And sometimes I just look at like nature, like pictures of like beautiful spots I've been to. I use that too. Yeah.
No, that's a really good one. And then the other advanced skills for this foundation of health and well-being, I would say, are developing a growth mindset, increasing your emotional intelligence, so working on that. We're not born with a certain emotional intelligence. We can improve that by practice. Being proactive about managing your stress. So, you know, almost seeing stressors coming, or, you know, just having strategies in place that can help deal with them, you know. For example, going back to my friend, Darren Davidson, who, as you know, has been practicing meditation for over 5 years now. We had a conversation about, you know, what the kind of benefits would be in terms of your emotional regulation, for example. And he said, well, people who have done more of it than him, you know, been practicing sort of 30 plus years, have like, well, you're still a human, you still can get triggered, but the way you respond is very different. So, you know, the intensity of your reaction, you know, in terms of how angry you might get at something, would be much lower, and the duration of that feeling as well would be much shorter. So someone who, you know, like me, is not particularly well trained in these things might get very angry and then you know, mull on it and kind of like, you know, just not get over it for like kind of 15 minutes or something. But if you're trained in meditation and things like that, it can, you know, be a much shorter lived and much less intense experience.
I totally agree with that. That resonates with me so much. And, you know, I'm somewhere between, you know, around 8 to 10 years of pretty daily meditation. And it was very sporadic before that. And I wholeheartedly agree with that. And what a brilliant strategy as well to look at, you know, and it kind of reconnects back to the meditation bit that you started with as part of the bedrock, right?
Yeah,
Which,
definitely.
you know, and we know like there are studies done with like, you know, monks who just go off into the forest and they have spent, you know, years years and years. They don't take a watch with them, so they don't actually know how long they've been there. And then, they return and they've been meditating and communing with nature, and their brain structure is fully different. And the way that they react to even physical stimuli of pain is completely different. They're able to maintain this like restful awareness, which we all have. It's just that all these layers of stress end up like sort of covering all that up. And so as we uncover the layers of the onions, we get to be our pure, unbound, infinite potential. But that really resonates with me. Absolutely.
Yeah, no, that's really, really good point. That reminds me of there's a meme that's doing the rounds at the moment. I don't know if you've seen it on LinkedIn about the monk on a boat in the middle of an empty lake, and the boat, and he's meditating and his eyes are closed. He's not seeing what's going on around him. But then the boat suddenly, jerks or something, and he immediately gets angry because he assumes that someone has hit the boat, like another boat has hit the boat or something. And then he opens his eyes and there's nothing there, and he realizes that all that anger was just totally internal.
Yes, that's great. Right. And that is really true. Right. And I think that's true for a lot of the perpetrators of some of these kind of aggressive or toxic acts. It is first, I think, internalized toxicity, aggression, anger, self-loathing. And then, of course, it boils over into others. And so a lot of it is just being able to change that, like you said, to get from self-anger, self-hatred over to neutrality, and then from there to self-love, which, can seem like a feminine concept, but that's just a human construct, in my opinion. Love is love, and love is universal. So I agree. It's a human concept, isn't it? It's not a feminine concept. It should be, normalized for both, for all genders. To be able to have that. So we're talking about reducing the kind of reactive behavior with stressors, improving self-confidence and self-esteem can work wonders. Working on imposter syndrome, is something that is an advanced skill, but if you can get that right, or get it as right as you can, then it obviously will help that foundation. Becoming more assertive, as I said, I did a teaching session on this for some family medicine residents recently, and so many of them just let patients speak to them how they want, and then they feel awful after that interaction when the patient has left the room, and they're berating themselves, like, why couldn't I have stood up for myself, and it's not, it doesn't mean getting aggressive, but it just means standing up for yourself and saying, this is not acceptable. But it is something that needs to be practiced, and will definitely help with your well-being if you can get on top of that. And also, again, back to conflict, just dealing with conflict in a more healthy way, not seeing conflict as something negative and something where you need to get aggressive, but something that can be, managed in a much more civil and courteous way. People walking around who are just terrible at managing conflict and either just get really angry or just, again, receive whatever treatment the other person wants to give them. That's not a way. That's not the pathway to a healthy life, So those are my bedrock and foundations, and then hopefully there's a lot of work. I'm not saying it's like all of this, just do this, just do ABC. No, you've got to really put in the effort and work on it for a long time, but ultimately it should contribute towards a happy and healthy life. Yeah, absolutely. And I think it's brilliant for so many reasons. But what I was sort of noticing was there's, by the way, as far as a Venn diagram goes between like Ayurveda meditation and, the work that you're doing, I think there are so many overlaps there because we taught, what you talked about was like your whole health. It's not just, are you eating well and, sleeping and exercising, which is usually where things stop here, at least in the US most of the time. And even that we hardly ever talk about, because we're encouraged to be more pharmacocentric than anything else. And the system rewards us for that here in the US. And so what I noticed, and I think what's really brilliant, is there's a lot of, mental health. There's emphasis on mental well-being. There's emphasis on emotional well-being. And then what I call spiritual well-being, which is just that feeling of connectedness and living, in alignment with your purpose. Those are things that we hardly ever talk about, whether it's in, professional lives, physician lives or patient lives. And so I think the idea that you're bringing forth and the way that you can present it is just absolutely wonderful and brilliant. And I appreciate that.
Thanks so much.
Yeah. So I know people are going to want to find you, Dr. Adam. How can they find you?
Okay, so they can email me, which is just Dr. Adam at coachingmentoringdoctors.com. Coaching Mentoring Doctors, one word. It's all lowercase. Dr.Adam. LinkedIn, Dr. Adam Harrison. I have a Facebook page, which is Dr. Adam Harrison Coaching and Mentoring Doctors, but other professionals are welcome. I have a YouTube channel, Dr. Adam Physician-Coach. Clubhouse room I mentioned with Dr. Davidson, that's high performing physician. And I'm on Twitter as Medical Leadership Coach, but I probably lurk more on LinkedIn than Twitter. I haven't quite figured Twitter out yet, really.
I'm still struggling with even LinkedIn and Twitter.
It's been years. I'm like, what's wrong with me?
That's okay. There's only so much time we have, right? So,
that is true.
So you got to use it well. But yes, I am so grateful to have spent this time with you and for this wealth of knowledge that you've given us. Really appreciate you being here. Thank you.
No, not at all. Thank you so much for inviting